Hi everyone, wanted to introduce you to case study assignment, group case study number 4. This is our last assignment in applied clinic theory. It is worth 15% and is out of 72 marks. I want to go through what it is with you. So, you guys are pretty familiar with case studies. You're going to be given a case study and you can work in groups of 2 to 3. You're going to complete a full analysis of the data that's provided. You're going to do a dental hygiene diagnosis, and you're really going to do a full comprehensive care plan, but also explanation. So this isn't really, you're not being marked here on your charting or the care plan per se. You're being marked on how you put it together and then how you explain where you got to where you got to. You're going to then present this in class to a small group of your peers. There will be a few different case studies given. You can use the clinic resources folder in our shell, and you can use your textbooks, and you can use journals, and wherever you find information, as long as you reference it, you're able to use it. You're going to find that, of course, your case study will be missing information. You can fabricate certain things, and you can make certain assumptions. You're going to use this document, you're going to cut and paste this into a Word document. This is where all of the work will be done. And then some EMR forms. So your first thing here is looking at medical, dental, social histories. You're going to do all of the bullet points. So give an explanation of the significant findings. Explain how these will affect the person's health and periodontal health. Make connections. Include a discussion on the need to clarify or consult on any of the medical history information, and if they need a medical consult, you need to create a medical consult in EMR and include that in your assignment. Scan it and attach it. EOIO and dental inspection, so discussing what's important that you found for that. Again, you can definitely chart it, but I'm not necessarily marking the charting. It's more about the discussion. Some students do like to chart it, they like to have the visual, and it can be helpful in your presentation as well. Periodontal examination, you are going to include an EMR form with the charting for your perio. Diagnosis, your significant findings. Risk assessment of local factors. In perio class, we're talking a lot more about systemic, and you can certainly talk about systemic here, but I'm focusing this section more on local factors. Keep in mind the marks are in the column here, how many marks per section. So it doesn't have to be huge. As you can see, the marks are not high, but you will get 0 if you're not doing these bullet points. So there won't be part marks if you're not covering everything in this area. Next is phase 1. So this is your care plan. So create to a diagnosis on the EMR form and make sure that they're accurate. And then fill out a care plan. So that's out of 8. Goals, interventions, expected outcomes, and evaluation. This next section is going to help you study for the final, be a good guide for your studying. You're going to incorporate the learning from each of the units of study from class and apply it to your client. So what we learned under medical consults, how are you applying that to this client? Dietary assessment and counseling, how would you apply this unit to your client? Root morphology, and so on. So each of these units, whether we have touched on them or not, you should be able to find enough information posted and or in textbooks to be able to at least give a bit of information worth the marks in this column to explain how this is relevant to the client that you currently have on paper or in your chair. You will be given some radiographs to interpret, and you will use an EMR form to interpret those. Phase 3 and 4 of treatment are restorative and then periodontal supportive therapy. So those are, again, quick discussion as to what you would recommend for this client as far as restorative, and what you would recommend for them as far as interval for cleaning in the future. This box here is for your references, so place all references here. EMR forms that are included must be attached at the end. These boxes are just for me to give you marks. You don't have to type anything here. It says no info required. So just that you gather the information, that you don't have errors, that you don't have spelling errors, that you use good references, and so that's your marks there. And then your presentation in class will take place week 12. So you will be presenting this case in about 5 to 7 minutes. Make sure you're introducing the client with accuracy. You can use PowerPoint and then show your EMR forms using the document camera. No spelling errors. Make sure you discuss the case with a good informed discussion, and make sure that you choose one area to focus on. So your case could take you 20 minutes if you were to discuss every aspect, but you can choose one area that you feel that you want to focus on related to your client, and that can be anything of your choice. That would be from one of these units. Make sure you can answer questions, that you make eye contact, that you're not just reading notes the entire time, and that you use professional language. That is the whole assignment. You will do all of the work before class, and then the in-class part is the presentations. You will watch at least 2 other presentations and give some feedback. If you have any questions, please email or come see me.